Hello and welcome back to GP Video Podcast by Nadia. So today I am going to wrap up the topic of colorectal cancer screening. So I will repeat all the important points once again for all of those who have missed my previous podcasts about colorectal cancer. So I'll start with the alimentary tract as always. So our gastrointestinal tract or alimentary tract is composed of mouth, pharynx, esophagus in the chest part, then stomach, small intestine, large intestine, rectum, anus out. Colorectal cancer or bowel cancer is the cancer of large intestine or large bowel and rectum. So depending upon which part it arises first, it's called rectal cancer or colon cancer, and together if it's in both the parts, then we'll call it colorectal cancer. So after small intestine comes the large intestine. Large intestine is connected to rectum and rectum to anus, and through anus the residual goes out. Okay, so now bowel cancer is the second biggest cause of cancer death in Australia, and it is the fourth most commonly diagnosed cancer in Australia, and it is estimated that 1 in 20 people will be diagnosed by the time they are 85. The average age at diagnosis is 69, but it can occur as early as in early 30s. And then there is a condition, a genetic condition that can lead to bowel cancer. That's another condition that I'm talking about that can be in the early 20s as well. So that is why cancer screening is very, very, very important. Now, why is it important? Why we want to detect the cancer early? Common sense. If the cancer is detected early, it can be gotten rid of and it will not spread in the body. If found early, 90% of bowel cancers can be successfully treated. So we don't delay, we do our bowel cancer test today. Okay, now it develops from the inner lining of the bowel. Bowel has got 3 layers: outer layer, muscular layer, inner layer. It develops from the inner lining of the bowel and is usually preceded by growths called polyps or adenomas, which may become invasive cancer if undetected. So once a colonoscopy is done, they have been detected, they have been removed, so they don't even get a chance to become cancerous, let alone the cancer being there. So they don't get a chance to be cancerous, and every 3 to 5 years, if you are prone to get polyps and adenomas, every 3 to 5 years colonoscopy is repeated, and if they are present, they are removed. And after 74 years or 80 years almost, these are gone out of the window. You don't need to do them again and they won't arise again. Depending on where the cancer begins, bowel cancer may be called colon or rectal cancer. It is the second biggest cause of cancer death in Australia. You have an increased risk of bowel cancer as you age. It can develop without any family history and show no signs or symptoms. Okay, so that is why it is very important to do the screening of asymptomatic individuals. Okay, now the thing is that for symptomatic individuals, I've said that again and again, if you have the symptoms and signs of bowel cancer, you need to go to your GP, because GP will start investigating you straight away. If needed, we'll do the stool test, which is called the screening test, the main screening test, which is called the fecal occult blood test, in which the stool is tested for occult or hidden blood. But if it's already you have come with the symptom of blood in the stool, then most probably GP will not do it and go for the blood tests, CT scan, and then refer you to the gastroenterologist for colonoscopy. Now, what can be the symptoms that you should be worried about? If any 1 or 2 or 3, all of them, please present it to your GP, because though having said that, these symptoms can be part of other GIT disorders as well. Let's say irritable bowel syndrome, irritable bowel disease, diverticulitis, and other stuff. But the first most sinistrous cause that a GP and you would like to eradicate is colon cancer. So what are the symptoms of bowel cancer? The symptoms are change in bowel habit, including diarrhea, constipation, or diarrhea alternating with constipation, or the feeling of incomplete emptying. A change in the appearance or consistency of bowel movements, such as thin bowel stools, blood in the stools, abdominal pain, bloating, cramping, anal or rectal pain, a lump in the anus or rectum, weight loss, unexplained fatigue, tiredness and or anemia, pale complexion, weakness and breathlessness, blood. So the ones that I'm talking about, weight loss, unexplained fatigue, tiredness, anemia, these are usually the symptoms of all the cancers. So if they are combined with the other ones that I have discussed before, that would make more sense. But otherwise, if you are having like a general weight loss, unexplained fatigue, again, you will go to your GP who will actually investigate you for all the other causes of weight loss and unexplained with fatigue and iron deficiency anemia, as well as the cancers. And then blood in the urine or passing urine frequently during the night, change in urine color, dark, rusty or brown. It is usually a sign of urinary tract infection or urinary tract stones or urinary tract cancers, but it can also be a sign of bowel cancer if it is also present with the other symptoms combined. So usually if you have 2 to 3 of all of these symptoms, then even if one, just please go to your GP and GP will investigate accordingly. So these are the symptoms that are the symptoms of bowel cancer, and the person who is symptomatic goes to the GP, gets investigated. Now, when we talk about the screening program, we talk about asymptomatic individuals, people who have no symptoms. So how we categorize people in that category? Okay, I'll tell you in a second. So average category is the people who have either no family history. First of all the categories are dependent on the fact that the people have to be asymptomatic. So asymptomatic, no family history, or one first degree relative or second degree relative who was diagnosed with colorectal cancer when he was more than 55 years of age. So we will be categorized as average risk. Okay, so either we have no family history or we have one first degree relative or second degree relative who was diagnosed with cancer, colorectal cancer, at the age of anything more than 55 years of age. So what's the screening program? These people can have fecal occult blood tests started from as young as the age of 45 years and go up to the age of 74 years. Every 2 years we can get that done. But so these are everybody, asymptomatic, no family history. This is everybody, or one SDR or FDR of more than 55. So previously we used to start it at 50 years of age, but now we started at 45 years of age. Every 2 years, stool test, screening test till the age of 74, and then no more, because then there are no more chances usually. Then we have got the moderate category. In moderate category, we have one first degree relative or second degree relative. First of all, we are asymptomatic. Then we have first degree relative or second degree relative who was diagnosed at the age of less than 55 or 50 to 55 years of age. So in that case, what happens is fecal occult blood test starts at the age of 40 every 2 years till the age of 74, and colonoscopy at the age of 50. So colonoscopy starts at the age of 50 and happens every 5 years till 74. So maybe for FOBT will only be done between 40 to 50, and then colonoscopy takes over, or FOBT and colonoscopy can both happen at the same time. I mean, together. So fecal occult blood test from the age of 40 for such people for the moderate risk, and colonoscopy at the age of 50. Colonoscopy is every 5 years. Fecal occult blood test is every 2 years till the age of 74 and then finish. The other option is that if, like, for example, either colonoscopy starts at the age of 50, or if like 50 to 55 years, if, for example, the relative was diagnosed at the age of 53, so the colonoscopy can start 10 years younger, which is at 43. We don't have to wait till 50, and we can start colonoscopy every 5 years from the age of 43. Then there comes a category which is called high risk, which has got so many people. So in this, you have to have a family first degree relative or second degree relative, 1 or 2, who were diagnosed below the age of 50 years. So in these people, fecal occult blood test starts at the age of 35 and colonoscopy starts at the age of 45. Again, fecal occult blood test every 2 years and colonoscopy every 5 years. So that was all about the colon cancer.